and welcome to this podcast for the University of Alabama at Birmingham Research Center of Excellence in Arsenicals. My name is Mina Nabavi, and I am a program manager in the UAB School of Public Health. Today on the podcast, we are joined by Dr. Ziad Kazi, Associate Professor of Emergency Medicine at Emory University, and Dr. Michael Kosnett, Medical Toxicologist and Occupational and Environmental Medicine Physician at the University of Colorado Anschutz Medical Campus. Dr. Kosnett is in Birmingham today for a seminar as part of the UAB Research Center of Excellence in Arsenicals, and is recording this podcast with Dr. Kazi to talk about poisonings by arsenic, arsenicals, and arsine gas.
Dr. Kosnett, thank you so much for being here with us today in Birmingham, Alabama.
Good morning. It's a pleasure.
I see in your seminar title that you plan on discussing arsenic, arsenicals, and arsine gas. Are these three different chemicals? What is common amongst these chemicals, and what is different about them?
Well, they share the similarity of all being containing the element arsenic. And arsenic is a naturally occurring substance. It's a natural constituent of the Earth's soil. But whereas some minerals have an essential role in the body, like iron or copper or zinc, arsenic serves no known useful function in the human body. And in various forms, it can be quite toxic. And the toxicity of arsenic is interesting because on the one hand, if you get enough of it, it can be life-threatening, and it can cause people to be critically ill very quickly with nausea and vomiting, diarrhea, shock, low blood pressure, acidosis, and require critical illness. On the other hand, low levels of arsenic that don't cause any symptoms have been associated with a variety of cancers, particularly lung cancer, bladder cancer, and skin cancer, and also cardiovascular disease and death from atherosclerosis and heart attacks, and adverse reproductive outcomes, and also diabetes. So
Wow.
When you think of one substance that can cause this range of adverse effects, it makes for a very intriguing and important public health problem.
Wow, this is interesting indeed. Now, these agents, for example, arsine, or let's say arsenicals, how do you encounter them? What are the chances that someone gets exposed to some of these chemicals, and under what scenario?
Well, my presentation today is directed at the CounterACT program here at the University of Alabama at Birmingham, which is really looking at agents that could be used to make people acutely sick. So I'm not going to talk about the concerns over chronic low-level exposures. Chronic low-level exposure is a big issue in the world because in some parts of the world where people get drinking water from the ground, deep aquifers, some of these aquifers are contaminated naturally with arsenic, both in the United States and, for example, in Southeast Asia, in West Bengal, India, and Bangladesh. Millions of people are exposed to elevated levels in the drinking water. But in terms of high-level exposure, there are a few situations where arsenic could be encountered in an industrial accident. And there are also situations where people could be exposed to inorganic arsenic in an industrial exposure, but that's uncommon to have high dose exposure. However, arsenic is notorious over the years as a substance that can be used for nefarious purposes. Everyone's heard the story, arsenic and old lace, about two old ladies who poisoned people with arsenic. But arsenic actually has been used and continues to be used from time to time as an element of poisoning. That is something that is facilitated by the fact that it's really relatively tasteless and odorless. And so sometimes it's been, unfortunately, used to poison groups of people by putting it in food or drink.
Yes, I remember the incident in Maine. People that attended church became poisoned with arsenic that was in the coffee, I believe.
That's right. This was in the early 2000s. There was a case in New Sweden, Maine, in which in a small community, an individual became disenfranchised with some members of his parish church, and at a Sunday get together after services where they had coffee and some food, a bunch of people became very ill with vomiting and diarrhea in the hours after the church lunch. And they investigated at first. They thought, well, it was food poisoning. But it turned out that it didn't take the normal course of food poisoning, because some of the people became critically ill. And then they suspected arsenic and actually were able to make a diagnosis within 24 hours.
Wow. Now, what about arsenicals? I think the CounterACT Center here at UAB is certainly focusing on research on arsenicals.
Okay.
Can you tell us more about
So
arsenicals?
the term arsenical is an umbrella term, which can actually mean all different types of arsenic substances. But in the context of the UAB program, there's particular focus on a type of arsenic that was developed in World War I called Lewisite. And it was named after actually a U.S. Army captain who was a scientist named Captain Lewis.
I could have guessed that.
And Dr. Lewis developed this agent. It's arsenic that's combined with carbon and chlorine in a certain formula. And it forms a vapor that can be delivered by bombs or in an explosive or canisters.
Like a chemical weapon.
A chemical weapon. And one of the features of it is that it's incredibly irritating to the eyes and the nose, the throat, and the upper respiratory tract. So people who are exposed to this will have difficulty seeing and breathing quickly.
And therefore, difficulty fighting.
Exactly. And it doesn't cause them to necessarily die immediately. It just disables them. And the thought in terms of a chemical warfare agent was that if you cause someone to be disabled but not necessarily dead, you actually disrupt the army more, because for every person who goes down with an acute signs and symptoms, 2 healthy people will be taken out of the battle to rescue them and extract them. It turned out, however, that as an actual gas, it wasn't as good as some other, or as effective as some other gas agents like mustard gas, because it was hard to establish a high enough concentration. It breaks down fairly quickly, particularly in humid conditions.
Does it affect the skin like mustard as well? Sulfur mustard?
It does. One of the things that Lewisite gas does is that one drop on the skin will produce a huge irritation and then ultimately a blister that will rupture and cause a big chemical burn, if you will, that will develop over the course of a day. One drop in the eye can cause a person to lose their sight.
Wow.
Now, there are some treatments that have been developed.
Oh, yes. It'd be great if you can tell us some more about potential treatments for these chemicals.
And this is actually one of the important reasons that the University of Alabama has this special center of excellence on arsenicals, is to understand ways in which we can effectively have countermeasures or treatments to give to individuals who might unfortunately be subject to exposure to these in a terrorist event or in another setting. And this initial development of the most famous antidote, or one that's still actually used today, is called British anti-Lewisite.
Hmm.
Now, it was developed by the British right before during at the very start of World War II. The British were very concerned that this Lewisite gas could be used against their population by the Nazis. And as you know, Britain was bombed repeatedly during World War II, and they wanted to develop an antidote that could be used as an ointment or a cream or a lotion that could be put on the skin right after someone were to be exposed, or drops of a solution that could be put in the eye to help people who got this in their eye. And it turned out that if given very quickly, it was effective in greatly ameliorating and in some cases preventing the sequelae of having these kinds of acute exposures. The study, of course, the testing was not so much done on humans as on animals. And fortunately, Lewisite was never used during World War II that we're aware of. There's no documented uses of it. But there was another situation where they started then using this BAL, or British anti-Lewisite, as an antidote to arsenic, and that was that in treating the adverse effects of antibiotic drugs that contained arsenic.
Antibiotic drugs that contain arsenic?
Yes. Now, we think of a lot of people think of the first antibiotics, which we use to treat bacterial and sometimes parasitic infections, as being based on penicillin, being the first one. But actually, the first antibiotics ever developed were organic chemicals that contained arsenic. And the first one was developed around 1906 by Dr. Paul Ehrlich, and it was an organic arsenical. And these antibiotics that were developed were particularly useful in treating syphilis. They worked, but they required fairly high doses. And not surprisingly, the drugs had their own toxicity. And sometimes when they were trying to treat individuals with syphilis using these arsenic-containing drugs, the people would get signs and symptoms of arsenic poisoning. And so after World War II, when British anti-Lewisite was available, people in the United States and Britain said, well, maybe we can use this to treat our patients who have side effects of arsenic-containing drugs. And it turned out that it was successful, and it was used for that purpose. And there are accounts of British anti-Lewisite being used in the late 1940s and the late 1950s to rescue people from the side effect of arsenic-containing drugs. Now, after the 1950s, as more and more other antibiotics, more advanced penicillins and other types of drugs became available, arsenical antibiotics have died off, and they're no longer used. There's still one type of arsenic-containing drug, milsapril, that is used for a rare type of parasitic infection that really only occurs in Africa. And we don't really see too much poisoning from that these days.
Fascinating. Dr. Kosnett, this has been a fascinating podcast discussion with you today. Thank you so much for sharing your wealth of information on this topic. And I hope our listeners will tune in as well and view your seminar that will be on our website.
Thank you, Gassi.
Thank you for listening. Please tune in next time for another episode from the UAB Research Center of Excellence in Arsenicals.